Hello, if you like the things I'm teaching you in dentistrymasterclasses.com and the Dental Minute, you will pay particular attention to these treatment planning videos. You'll also pay a particular attention to the new patient interview, new patient exam, and consultation videos in the library of dentistrymasterclasses.com. The foundation of my practice is the new patient interview, comprehensive exam, and consultation. Let me begin with the patient walks into the office. It's very important when the patient calls the office that you've got people on the phone that know what to say. It takes a lot of courage to call a dental office. And so I've got a systems notebook that I've written on what to say in every situation, including what do you say when a patient calls the office. I want that information before I see the patient in my private office for an interview. And at that interview, I'm basically finding out who's connected to the teeth. What got you here? What motivated you? How did you find out about us? Those are critical pieces of information in a comprehensive practice. I then want to perform a comprehensive exam, which involves a full mouth set of radiographs of all the teeth. You can do 7 vertical bite wings and a pantograph. You could probably do just a cone beam radiograph. Then we do a comprehensive exam. Then I take diagnostic photographs of the teeth. And I show you how to do this in the part on new patient exam and consultation in the library of dentistrymasterclasses.com. The patient then returns to the office for a separate formal consultation. Now, at that consultation, I want everybody involved with the finances to be in on that interview so they can see the PowerPoint cases I'm showing them, the books, the aesthetic restorative dentistry and the dental diagnosis books, and then they can look at the diagnostic photographs of the new patient's teeth and the radiographs of their teeth if that's necessary. The objective is you don't ever want a patient to question that what you're telling them is the truth. Finances always enter in, but present it in a comprehensive way and let the patient decide what do they want to spend, how good do they want it. And I ask the patient those types of things at the examination appointment. I say, how good do you want this? Do you want to fix everything that's broken or that's pathologic? Do you want to do something about the cosmetics of your teeth? So let's look at these cases, which are typical cases that walk into my office, and let's see what came of it after performing an interview in my private office, a comprehensive exam, which in my office consists of full mouth set of radiographs, bite wings and periapicals, a comprehensive exam of the teeth and the soft tissue and the bite, the occlusion muscles of mastication, and diagnostic photographs of the teeth. This woman, nice woman, she could afford to do anything she wants to do. She'd not had good experience with dentistry and was hesitant to take on a big restorative case. But when you do the comprehensive exam, which is what this seminar is about, she can see what I see. And then the magic of it is showing her other comprehensive cases that I've done. So she can see you go from here to here and you've got a car that works. You've got a house that functions and looks good. You can see you always want tooth display with lips in repose. So her teeth were a little too short. And she had that tetracycline stain, chipped teeth, abfraction, just old leaky restorations on her posterior teeth, decay and abfraction here at the gingival facial of the teeth, old bridges they'd done root canals through, worn. I always tell patients it looks like a patchwork quilt, that somebody's worked on you that was well intended, but it's like somebody's house that they remodeled a room at a time, and it looks like 5 different houses put together. It just doesn't look good. She was starting to have some sensitivity with some teeth, so I wax it up ahead of time so I know where we're going. Now, I don't wax it up if I haven't generally talked to the patient about what is going to happen and what it costs, because somebody's got to pay for that wax up, and I don't really want to do that until I know we're going to move forward with the case. But I've given her a general idea of what it would cost to fix everything. And as I said, in this case, it was no issue. And so we've veneered the maxillary and mandibular anterior teeth, replaced all the old stuff, crowns up here, bridge over here, crowns, composite. It's had a cracked tooth right here. We placed crowns on that tooth, bonded composite here. Lengthen the teeth so she has tooth display with lips in repose, and you end up with a nice result in a comprehensive case. I never really worry about the cost of the case initially. I think, what would I do if it was me or my family? What would I do? So I'm coming from the heart, the right place in the heart. And then let the patient tell you if that's in their budget, if it's a comprehensive case like this. What if it wasn't? Then I might do part of it. Since unless we're increasing vertical dimension, we can do it in phases. And just see if you can't work something out. Every now and then you just can't get there from here. But most of the time we can work something out if the patient wants to have it done. All right, this guy, an old rancher, just teeth pretty beat up, hadn't taken real good care of them. And I love these cases because I say, where are we going with this? What's your idea? He said, I want to fix all my teeth. And I said, okay, you're going to put a pretty nice car in here if you fix them all. If you fix them, fix them. Now you can do some fixing and do less than that, but if you fix them, you're going to put a pretty nice car in here, a really nice car. And he said, I want to fix them. I want to have my teeth. He's missing all of his upper posterior teeth, upper right and upper left. These teeth are beaten up down here. We lost the lateral incisor. It's decayed. See, all those posterior teeth are missing. And he said, I don't want anything removable. I said, well, if you don't want anything removable, there's not enough bone back here for implants. I'd have to do a sinus lift and bone graft and put the implants into that. He said, whatever it takes, I want to do it. So I waxed it up, restored the lower teeth with veneers on the anterior teeth, crowns and bridges on the posterior teeth. We lost this lateral incisor from just badly decayed, and you can see we've got no posterior teeth at all. So I did sinus lifts and bone grafts and placed the implants. Just went back to first molar. That's plenty. And then an implant in the lateral incisor. So here he is before and after. All the posterior teeth stored with implants, crowns, sinus lifts, implant here, ideal occlusion. Teeth length is ideal. But that's a bad boy case there. That is complicated. And that's why I want to have a heart-to-heart with this guy and say, are you up for this? Because I'm going to be seeing you quite a few times, and it's not a snap of the fingers. We're going to be working on this, because when I do sinus lifts with bone grafts, I want the implant to integrate into that bone graft for 6 months. Now, some people try to go forward in 3 months. I want to have every chance of this working. I want it to integrate for 6 months. So this case is probably going to take 9 months from beginning to end. He says, I'm up for it. I'm planning on living a long time, and I want my teeth to look good, and let's go.
Take your practice to the top tier. Subscribe to dentistrymasterclasses.com for an organized library of all the Dental Minute videos, plus many complete comprehensive cases and many very important articles. New cases are added weekly, only $20 per month. Subscribe now.